Hi, I'm Dr. Catherine Durborough. Welcome to the Center for Aesthetics, and thank you for entrusting your healthcare to our practice. At the Center for Aesthetics, we want you to know that you matter as a person, not just as a patient. Our professional staff will be available to you 24 hours a day during the surgical experience and in your postoperative healing period. The purpose of this video is to provide you with detailed information regarding blepharoplasty surgery, how to prepare for the surgery, and what to expect in the postoperative period. During our consultation, you will have plenty of time to discuss any specific questions or concerns you may have regarding your personal experience. Blepharoplasty surgery is the most commonly performed plastic surgery procedure, and most patients find the experience a lot simpler than they thought it would be. The purpose of a blepharoplasty is to remove excess eyelid skin, which is obstructing the vision or causing other symptoms. Surgery is performed in an outpatient surgery facility under a small amount of IV sedation. Because of this, you will need to bring a driver on the day of surgery. During the surgery, you will be very comfortable. The medications you are given will make you drowsy, and most patients do not recall any details about the operative experience. The procedure involves making an incision in the natural lid crease. This is very important, as by doing so, the incision is concealed in a natural skin crease and usually is not visible after you are done the healing process. In some patients, fat contouring will be done to remove bulging fat pockets to improve the contour of the eyelid. The procedure takes about an hour to perform, and you will be ready to go home from the surgery center within about 20 minutes. The good news is that pain is not a prominent feature in the postoperative period. On the day of surgery, you may experience a short period of some burning and stinging as the skin wakes up, and you may have some dull headache-type pain that is controllable with pain medications or even non-prescription pain relievers. By 24 to 48 hours after the procedure, you should not be experiencing any further discomfort. Pain is such an uncommon symptom after this type of surgery that if at any time following the procedure you are experiencing more than dull headache-type discomfort, you should be notifying me. You will have bruising and swelling. There are ways to minimize this, but every patient will have some evidence that they have had recent eyelid surgery for about 2 to 3 weeks following the procedure. There are 4 ways to minimize bruising. Number 1, get off any medications that could be potentially thinning your blood. This includes aspirin and aspirin-containing products, as well as nutritional supplements that have high doses of fish oil. If you are taking prescription blood thinners, such as Tyclid, Plavix, or Coumadin, please notify me during our consult time, and we will decide the appropriate duration of time off of these medications prior to surgery. Number 2, get on Arnica montana. Arnica montana is an herbal supplement that has been clinically proven to reduce bruising and swelling, and to help the bruising that you do get go away faster. Arnica is available at most health food or nutritional supplement stores. It is best to start Arnica 1 week prior to surgery and to continue for a week following surgery. Arnica has not been shown to interfere with any other prescription medications. Number 3, ice, ice, and more ice. On the day of surgery, you should plan to nearly continuously ice your eyelids once you get home from the surgery center. You will be provided an ice pack to bring home, but another good choice is frozen peas or corn in sandwich baggies. I find these conform to the eyelid better. Have several sets prepared and in the freezer before the surgery, and you can rotate these onto your eyelids to keep them iced. And finally, number 4, when you decide to go to bed that night, you do not need to ice your lids throughout the night, but please try to sleep on your back with your head slightly elevated. If you are a face or a side sleeper, you may even want to consider a reclining chair for the first several nights. The day after the procedure will be the worst looking day. By then, the swelling and bruising will have settled in. You may get a lot of sympathy from those looking at you, but you should not be having any discomfort and you should be feeling very good. The bruising and swelling will gradually start to fade over the next several days, up to 3 weeks. Physical activity during the first week after surgery should be limited to light lifting, and no strenuous activities should be performed. No swimming should be done until the sutures are finally dissolved, which is about 7 to 10 days. Your first planned postoperative visit will be at 1 week after surgery. In general, no sutures will need to be removed. Unless I tell you differently on your postoperative visit, you may resume all normal activities after the first week. You should not apply makeup directly to the incision site until the scab is gone, which may take up to 10 days. You may apply makeup elsewhere as soon as you desire. You should be feeling confident about your appearance by the end of the 3rd week after surgery. This is the time frame that most patients feel like they look better than they did before surgery. Certainly, that is not your end result, however. The contour of the eyelid and the appearance of the incision line will continue to transform for several months following surgery. Risks are exceedingly rare with this type of surgery, but we always need to discuss them prior to proceeding. In general, bleeding and infection are the 2 things that any surgeon worries about when performing surgery. Fortunately, these problems rarely occur with this type of procedure, but usually the first indication of a problem would be increasing pain. The way to stay out of trouble is to always keep an open line of communication with me. I am available to you anytime, day or night, and encourage you, if you have a question or concern, to call me. Our answering service answers the phone 24/7 and always knows where to find me. Some people are fast healers, some people are slow healers. Some people bruise easily, some people barely bruise. These are the things that we may not be able to control. If you feel that you have any particular susceptibility to post-operative problems, please notify me during the consult and we can address them together. We are honored that you chose us for your healthcare needs, and we look forward to having you as our patient at the Center for Aesthetics.